Did you know it's been over 50 years since Northern Ireland last reviewed our legislation on suicide? It was in 1961 that suicide ceased to become a criminal offence in Northern Ireland, and at the same time, it became an offence to assist somebody to end their own life. Now, I'm not an expert on law, but from my general understanding, law plays 4 primary roles in society. It protects people from harm, it ensures a common good, it settles disputes and arguments, and it persuades people to do the right things. Now, I'm particularly interested in that first aspect of law, protects people from harm, and how law can be used to reduce the unacceptably high death rate in Northern Ireland. But before I look into that a wee bit further, I'd like to consider first another preventable harm, road deaths. I think it's one that we're maybe all a bit more familiar with. I was born in 1977. I'm 39 in case any of you are trying to work that one out. And 1977 was also the year where Northern Ireland reported the second highest road deaths on record. There were 355 people died on our roads that year. But something quite remarkable has happened in Northern Ireland road deaths over the last 40 years. In my lifetime, road deaths have reduced by 80%, from 355 the year I was born to just 74 last year. Now, that's still 74 too many. How was this achieved? It was a range of strategies, and our laws played a really pivotal role. So from education, if you remember back in primary school, if you're of a similar era to me, you got your Tufty badge for saying that you knew and understood the Green Cross Code. Right through to current days. So in Northern Ireland at the minute, we have the Share the Road to Zero campaign, which looks towards driving road deaths to zero. As well as education, we also have skills testing. In order to get our driving licence, we have to demonstrate our skills and ability to drive safely. And that's backed up by theory testing. I didn't get my driving licence until I was 30, so I was one of the ones who had to do the theory test. And the theory test shows that you have the knowledge and understanding behind the principles of road safety. We also apply quite quickly learning from road traffic collision investigations. For example, at the minute, by law, airbags have been introduced as standard to make the cars themselves safer. We also have enforced speed limits. There's a ban on drink driving. And during this time as well, the infrastructure has improved. The roads themselves have got safer. So what's this got to do with suicide? Well, both road deaths and suicide are preventable harms. In 2004, the World Health Organization declared death by road injury preventable, and a decade later, in 2014, suicide preventable. And while road deaths have steadily reduced over my lifetime, by comparison, suicide has more than tripled. There were 95 reported deaths by suicide the year I was born. And last year, there was 318 people died by suicide in Northern Ireland, devastating families and communities. It's almost 1 death per day. You might also be wondering the significance of 1997. It was 20 years ago that I lost 3 close friends to suicide. And this motivated me to more fully understand suicide and search for the reasons of how to prevent it. I've been working in suicide prevention for the past 15 years, and it was only about 5 years ago that I came across the Zero Suicide Model. In essence, the Zero Suicide Model is a patient safety model designed towards eliminating patient deaths by suicide. In over 200 healthcare systems worldwide have adopted the Zero Suicide Model. So that's over 200 pilots globally, and they are reporting fantastic results. They're reporting saving lives, and it gives me such hope. However, my concern is that when a system of care looked towards adopting a Zero Suicide Model, they find that they're quite quickly faced with resistance. Now, you might wonder, why would health and social care professionals who have entered into a career to help people be at all reluctant to work within a patient safety model, a zero suicide model? Well, health professionals are no different from you or I. Like us, they've been exposed for many years to common myths about suicide. Myths like, if someone decides to end their life, there's really not much we can do about it. Remember, suicide is preventable. Or the myth that by simply asking someone if they're having thoughts of suicide risks putting the idea in their head. It's simply not true. Part of introducing a zero suicide model is to survey staff attitudes towards suicide. And in a survey of over 3,000 mental health practitioners, found that almost half felt neither confident nor competent to work with someone at risk of suicide. This includes, and you might find that it surprises you that mental health care practitioners felt underconfident in how to work with someone with suicide. However, you have to remember that providing effective care, assessing and treating somebody at risk of suicide is not part of standard training for health professionals, including doctors, nurses, and counsellors. This was my experience 20 years ago. When I was a young adult, I was suicidal. I had a plan to end my life. I was referred to mental health services, and not once throughout my treatment was the word suicide mentioned. My experience was that my thoughts of suicide were met with silence, further accentuating my sense of shame and isolation. I've been reflecting upon my experience for the last number of years. Mental health practitioners at the time felt that they couldn't work with my suicidal behaviour. What had them underconfident? Remember what I've said about 3,000 mental health practitioners, almost half felt neither confident nor competent. So I've been thinking about what our laws can do to help prevent my experience of silence, which is still commonly reported today. And I think our laws, not unlike the laws for drivers, in order to have a driving licence, they have to demonstrate their skills and ability to drive safely. If we introduced a law, a statute, that required health professionals with mandatory training to demonstrate their skills and ability to work with somebody at risk of suicide in order to get a licence to practice, I think this would make a really big difference. But my thoughts around suicide and law doesn't just stop there. So imagine a scenario, if on my way home tonight, I'm involved in a car crash. I'm brought to hospital, my injuries are treated, and as you would expect, a nurse will ask me for details of my next of kin. They'll contact my family, explain, it's okay, she's been in an accident, she's not injured, but she's a bit shocked, and we need to get her a lift home. However, if on my way home tonight, I try to kill myself, I'm brought to hospital, my injuries are treated, and I might be asked, is there someone we can contact? But if I seem at all reluctant, which I most likely will do because of the shame associated with suicide, my loved ones will be none the wiser that tonight I tried to end my life. I'll go home alone. And we know one of the risk factors for suicide is isolation, and reconnecting people back in with their loved ones counters this risk, yet it doesn't happen as standard practice. My parents only became aware a few months ago when I told them that as a young adult, I was suicidal. My doctor knew, mental health services knew, and not once was it discussed with me about the possibility that either I or them speak to my parents, respecting my patient confidentiality. And I've been thinking about this also, and it seems to feed in with that myth that suicide is a choice. After all, I was legally an adult. I'd made a decision about my life, and my privacy and autonomy should be respected. The problem was, I wasn't making a choice. I was struggling with unbearable emotional pain. And my parents were none the wiser. I had a really good relationship, as I do now, with my parents. My dad was a charge nurse in an acute mental health ward. No better people to speak to help me through this time of crisis. And yet patient confidentiality stopped that happening. I missed out on the support that I could have had. Again, I think our laws can play a really pivotal role to change this experience. Imagine if by statute, our laws required not only professionals to speak to each other when somebody is at risk of suicide, but more importantly, to speak to families, to let them know their loved one is at risk of fatally harming themselves, and to talk about the support that could be put in place at home. Remember those couple of key roles that law plays: protect people from harm and persuade people to do the right things. If they were introduced into our laws, I think this would make a really significant difference, and I think the timing's right. Our government is looking towards introducing an outcomes-based model, and what better shared outcome than working together towards zero suicide? I think at the very least we need to be having this conversation, rather than working within an outdated 1961 Suicide Act. We need to move towards a Suicide Prevention Act. Thank you.